Yeah, good morning, and thank you, Roxana, for the introduction. So I'm going to talk on a few things on how clinical practice can be enhanced using apps. I have now a financial relationship with anything that I'm going to talk. So just to tell you what are the key areas that we can improve using digital innovation is patient experience, understanding for the patients, care team communication. That's what I'm going to talk on next. Optimization tools, help in better diagnostic tools, and of course educational apps and big data, where I think a few people will be talking using massive algorithm to make things easier. So important initiatives we have had are the four in the Cath Lab. The STEMI, coming to the STEMI, I think we all interventional cardiologists are still very interested to make sure what we can do better in STEMI care, and I think we have hit a plateau with regards to what we can do. For a referring institution, what is important, because we are a large healthcare with multiple sister hospitals involved who want to send it to the hospital which has a Cath Lab. So door in, door out have to be less than 45 minutes. And for us, we have to pay attention that if it is non-transfer from our Cath Lab, the door to balloon time has to be 90 minutes, and transfer time, if it's coming from outside, less than 120 minutes. We all know that, but there's nothing improvement that has happened over the last, I would say, 7-8 years, even as like the AHA registry, everything has told. So there are multiple challenges why we cannot achieve is all this is that we talk here between the emergency room, the Cath Lab team, and of course, if you're transferring between sister hospitals, we have a transfer center that has to bring the patient. Right now, it happens with the phone call pagers and of course, people's own messages, chat messages, which is not HIPAA controlled. And then if you see here, Mission Lifeline Registry has over 170 things that we need to enter for the patients to make sure they are entered in a registry, which you need a one full-time FTE. This is just to show you the app that we created as a communication platform. One of the case from the sister hospital to us who presented at 3 a.m. in Mount Sinai, Queens. So how does this happen? That young patient that comes with anterior ST elevation, with hypertension, smoking. So how does the app work? That you press the button and then you take the EKG picture and then you send it to the on-call attending. So you have a direct connection with the interventional cardiologist, no in-between person, direct connection with the interventional cardiologist. Now there are a few things that they need to add. And of course, in the next generation, when we are going to incorporate EMR, a lot of this will be gone. And once that happens, I will look at the EKG. If I need to talk to the ED physician, I will have, I can call the number, contact number is right here. I can call them, or if I need to do a video call with that referring ED doctor, I'll do a referring. So I'll have a 2-3 minutes discussion, and then I will say, yes, I've accepted this patient. When that happens, the entire team gets notified. The entire team of the Cath Lab, which includes the nurses, the technician, the radiology technician, the CCU, who will now know there's a STEMI that is coming and that they better be prepared, and Cath Lab will be prepared. Now, what else we need for preparation of the Cath Lab? Most important thing the nurses want to know is some basic history of allergies, and so the nurse of the ED and the nurse of the Cath Lab will have their own chat. Everything is HIPAA compliant here, and if the patient has any signs of shock, the shock vitals could be entered, but of course when we become, we can incorporate with the EMR, that can be added. In a city like New York, when it's so busy, okay, this was at 3 a.m., you can see that there'll be no traffic, but in the middle of the day there is traffic, so we can GPS track the ambulance that is in Queens coming to us directly, and everything else is time-stamped. So if there is any QA issue, everything is time-stamped right from the time the activation happened. This was that case, that mid-LAD thrombotic lesion, you can see there, single stent was inserted, middle of the night, this is the EKG immediately post. And door to the balloon time, transfer time, close to 90 minutes here. So this is what we have achieved. So when we first presented, made this STEMI app, actually the rationale and design was already published in European Heart Journal Digital Health. And our initial experience of the pilot implementation actually will be presented as a moderated poster in ESC 2022. This was just a case I showed you. The cases that we have done will be showing that. The other thing that we have challenged is tower scheduling. And why this is so challenging? Because we have a team of people involved. There's a referring doctor, which include, and then there's a patient family and the caretakers, accepting, which is many people, which is interventionalists, a CT surgeon, vascular surgeon, anesthesia, ICU team. So many workups have to be done. Everything needs to be coordinated. Not that easy to coordinate all these things. So we created what is, we called it TowerBot, but essentially it is for all structural cases. As soon as a referring doctor calls, we will register the patient into this system, and then a link is sent to the patient so that that link becomes to that particular patient. And after that, they part of the bot where they will understand how to go in, review what the procedure is. They can watch videos. A lot of educational materials are provided to them. And then when the multiple appointments are done, they will get all the notifications where to go, how to go. Also for us, interventional cardiologists, referring cardiologists, they can log into this portal and then see where and which part of the scheduling the patient is, and will know what has been decided. And at the end, everybody, means the patient especially, can go and do an survey, which we normally collect from this patient. The third point that I need to highlight is, can we use the app and do trials? And this is where I want to tell you that the trial that we are doing to show that regular lifestyle modification versus yoga, is there a way that we can show that in patients with CAD or metabolic syndrome, that chair yoga is probably better. And if you see here, what did we do in this? That we created this app. The patient, once they are enrolled, they will download the app, and you can see that various videos created by this, actually she's my personal yoga teacher, and people can watch this at home. And other thing is, we can track everybody that has been enrolled in this trial. And if they have not done the yoga for a number of times a week, they get this notification. And also this is the habit of every patient can snapshot, because we get the consent. Very important that we have their consent saying that yes, we are going to monitor you, and then this is how we can say that this person was non-compliant. Then our coordinator can give them a call. Final thing is the educational apps that we have created. The timeline, the first one we started 2017, and we have been developing so many educational apps. So a couple of the apps that I wanted to show and go over: the Guidewire app that we published last year, actually on November 2021. For interventionalists, very important, if you want to see, it's a lesion based, whether it is CTO wire, non-CTO wire, and then we go over each wire description. The most important thing is that there's a wire library. Over 130 coronary guide wires. The description of each wire, why which wire to be used during which difficult cases, everything has been discussed in that app. And this is, if you want to do CTO, which we'll be doing a couple of CTO cases later on, understand each wire for the antegrade or for retrograde. And if you're taking just fielder, I'm just giving you an example. If you want to understand fielder, there are several fielder wires, so property of all these wires can be understood. The device aid is, we are releasing it today. The mobile app will be ready soon. But what is device aid? It's the same. There are so many devices in the Cath Lab. So do all of us know every device? Probably not. So there is a beautiful library that we have created. So we start from the access, then you go to the sheath, the diagnostic wire, the catheters, guide wire, and everything that has been discussed. So this web app, which is all ready, and you can go in right now and start accessing and explore the device aid to understand what are the various devices Cath Lab has. This is just to give you a snapshot of the devices that we in the Cath Lab use it. And every device has a small description to understand exactly what the device and what it's used for. And Angio 3D will be coming maybe later part of this year to understand the engagement of the coronaries and also to which views to be used at which time. This is more of a gaming app. Exactly how to do it. You see that you can inject dye, you can advance the catheter, and use a toggle button so that you can pan. So that this will be probably helpful for more of the cardiology fellows also to go there. Thank you for your attention. And this is all the apps that were created and the device aid that just released today.
Unbelievable work, a decade of work in less than 10 minutes. Thank you, Dr. Kini. You are really, really making a huge difference on this educational app tools.